Did you know that many women are unaware that they've entered perimenopause, which leaves them completely unprepared for what they experienced or confused by the signs and symptoms that go with perimenopause? Today on the Wild Wisdom Show, we're going to be talking about this very important topic, answering the question: have you entered perimenopause? The telltale signs, stages, and blood work that can be used to determine this. Now, what's important about raising awareness around this issue is that, as I mentioned, it can leave you more prepared to be ready for the experiences of perimenopause and less confused by the common symptoms that are associated with it. And interestingly, there have been a group of researchers and scientists and doctors that have come together to define the different stages of a woman's reproductive life so as to help women navigate these stages, and also the doctors and having good conversations with them about it, and as well as researchers, because when we do research on the different stages, we want to be sure that we're taking the same kind of groups of women to do the interventions and look at the results. So this is called the Stages of Reproductive Aging Workshop. And these experts have determined that there are 7 stages in a woman's reproductive life. Now, this is as per their definition, but we find it quite helpful in assisting people in determining where they are when we have more clear definitions as to the stages. And with these definitions, the stages are determined by menstrual cycles, as in the changes in them over time, as well as hormone changes, which can be detected through things like blood work or urinary testing. Now, of these 7 stages, 5 of these occur before the last menstrual period, which is menopause, and 2 stages occur after that last menstrual period. So we're going to quickly review these because it puts into context the stage of perimenopause. So stages 1 to 3 are called the early, peak, and late reproductive stages. So you're getting your menstruation, and if you were to test your hormones, there would be certain levels that you would see in your hormones. In stages 4 and 5 are the perimenopause stages, and they're divided into 2 stages. The first is called early menopause transition, and the second one is called the late menopause transition. So the word perimenopause is not specifically used in this definition, but rather it's a transition from the reproductive stages into the menopause stages, and there's an early phase and a late phase in this transition. And then the stages 6 and 7 are the early postmenopause and late postmenopause. So after that last menstrual period, the first 4 years after that are considered the early postmenopause, and anytime beyond that would be the late postmenopause. So how to know if you're in perimenopause or transitioning into it? So let's go into that. Now, to know if you're transitioning into it, you need to know a little bit more about the stage before perimenopause. So, before perimenopause, the stage is called the late reproductive stage. So, you have regular menstrual cycles, but your follicle stimulating hormone, which is a specific hormone that can be easily tested on blood work, very affordable, cheap to do, and any family doctor can order it. It's called also FSH for short. That can either be normal level, as in the lower range, or it can start to climb, start to get a little bit high, indicating that you're starting to get closer to that perimenopause first stage called the early menopause transition. Now, interestingly, in this late reproductive stage, even before you've entered perimenopause, you can actually start to experience symptoms. And these symptoms can be due to subtle shifts in the hormones that are being produced by the ovaries. Nothing that could be detected necessarily on blood work, and nothing that's really changing your cycles all that much. Your cycles are still regular by definition in this phase, but you could start experiencing some mild hot flashes, night sweats, breast tenderness, trouble sleeping, migraines, and mood changes like irritability or anxiousness. So I found this to be actually quite interesting because some women, their periods are fine, but they're starting to experiencing these shifts. And if your periods are still regular and your FSH tests are in the normal low range, then you would be considered to be in that late reproductive stage, which is different from your peak reproductive stage, what happens before that, where your hormones are at their normal cycling. There's no really abnormal changes in your hormones, whether it's subtle or not. You have very regular periods, you're very fertile, and that stage is preceded by the early reproductive stage, which is just around the time you hit puberty and a few years after that, where your cycles are still a bit irregular. I don't know if you remember, when you hit puberty you get your period, but it doesn't really get very regular until after a couple of years after that. So those are the three reproductive stages, and that late reproductive stage just before perimenopause can be associated with symptoms. So I found that to be very, very interesting. Now, one common question that comes up is, well, what age should I expect that? When should I expect to be experiencing that late reproductive stage, heading into perimenopause? And the answer is that it's different for every person, very variable. We can work our way backwards, understanding that the average age of menopause in the USA, at least, is between the age of 45 and 51 years, give or take. And perimenopause, the stage before menopause, when it's been studied, it can last anything between a few years to up to 14 years even. So that means that you could be in your late reproductive stages as early as in your 30s. So it's less about your age, although that gives you some idea. But it's more about your cycles, your symptoms, and your blood work. So we're going to get into now the perimenopause stages, and we're going to dive into that early menopause transition versus late menopause transition so you can determine where you are. So one question that's come up so far is Shay's asking, how long, months, or years will menopause last? So menopause is a specific point in time where it's determined as being your last menstrual period. So, on the date that you've had your last menstrual period, that's menopause. You will only know that that was menopause 12 months after that, when you haven't had a period since then. So it's kind of like a retrospective looking backwards moment. The perimenopause transition, which we're going to talk about now, can last anywhere from, if you've had a menopause that's been induced by medications or surgery, the perimenopause transition of going from having, the ovaries functioning to not having the ovaries functioning can be in the matter of days, weeks, or months. But if it's a natural perimenopause, that can be, a year, a couple years, up to, as mentioned before, even 14 years. So now let's get into, what does that perimenopause stage look like? And these stages from early menopause transition to late menopause transition can last, as mentioned, up to 14 years for some people, usually less, but it can happen. So, for you to know that you've entered from that late reproductive stage into early menopause transition, that first stage of perimenopause, you will still have regular menstrual cycles, but the length of that cycle changes by 7 days or more. So, for example, let's say you used to have a 31-day cycle. Now you would have a 24-day cycle between the time that you menstruate and the next time you menstruate. So that cycle is still regular, but the duration of the cycle, the time in between your period, is changing, and it can be, less time or more time, but that difference is supposed to be around 7 days as a definition that you've entered into that early menopause transition, or that first stage of perimenopause. Now, the second criteria, which is less important, but still, something to consider, is whether or not your follicle stimulating hormone, or FSH, is increasing. So when you do your blood work, it's starting to get higher. And now you have to test that with estrogen, but your estrogen could be normal level, it could be very high, or it could be low. So the estrogen levels going into perimenopause are not as important and not as helpful as follicle stimulating hormone. And this is how a doctor would test your FSH. They would need to do a blood work request for you to get blood work done, testing both FSH and estrogen, which is called estradiol on the blood work, on days 2 to 5. So either day 2, 3, 4, or 5 of your cycle. And that's when day 1 is when you first bleed on your cycle. So you first bleed, and that's day 1. So on days 2, 3, 4, or 5, you go and get your blood work tested, and you would get your estrogen and FSH results back. Now, if your FSH results are high, then that helps confirm that you are in the early menopause transition, so long as your menstrual cycles have changed in length and are still regular. So the two of them together are confirming, like it's very, the doctor can confidently tell you, yes, you are in that stage, or you can be confident in that stage. Now, if your estradiol result was high and your FSH result was normal, then you don't use that FSH result, because a high estradiol will push your FSH down. So it's like, so you can't use that test. You kind of have to throw that test out, not a useful test. But if the FSH is normal and estradiol is normal or low, you have to retest it. You can't take that normal, that one-time normal test, because it may be that it was just that day it was low, right? And that overall, the trend is that FSH is getting higher. So typically, if you have a normal FSH, as in it's a low value, doesn't look like you're in perimenopause yet, you would retest it again, and you would see that if the FSH is starting to increase over time, again, you're more confident that you've entered into that early menopause transition, that first stage of perimenopause. But again, the most important sign is that your periods are changing in length and are still regular. Now, estrogen itself, as I mentioned, cannot be used to determine perimenopause. And it also can't be used to help with things like hormone replacement therapy, surprisingly, because you can be very symptomatic with, getting lots of symptoms in that early menopause transition phase. So that's another thing, that the symptoms that could be present in the late reproductive stage could continue into that early menopause transition stage, or start showing themselves in that early menopause transition stage. And your estrogen could be normal, low, or even high. And it's interesting because that high, that very high value is something that can happen in perimenopause, where estrogen goes higher even than it would normally would. And so even though overall, as we go into menopause, our estrogen is declining, there can be events where estrogen goes too high. And those are actually called luteal out of phase events in medicine, where you test the estrogen and it goes too high. And that too high estrogen sometimes is what drives our periods becoming, too long or too short during this phase. So that's a very interesting phenomenon, which means that we can't use estrogen to define our transitioning into perimenopause and through perimenopause. Same thing with progesterone. Progesterone can be normal or low in the luteal phase, and luteal phase is the phase just before menstruation. So progesterone, if it's going to be tested, should only be tested towards the end of the menstrual phase, so around day 21 of the cycle, give or take a few days, depending on whether your cycle is longer or shorter than the average 28-day cycle, for example. But that also cannot be used to determine perimenopause. So really, in summary, to know that you've entered perimenopause from that late reproductive stage into the early perimenopause transition or early menopause transition is that you have regular cycles that have changed in length over 7 days difference than you were before. And you have an increasing trend in your FSH, but a few tests could be normal still if you were to test it. The problem with FSH is that there's no specific cutoff for what's normal and what's too high when it comes to perimenopause. So the levels in perimenopause can really change day to day, month to month. It can vary significantly, and they don't get stable, at a very high level, because the trend in FSH into menopause is to keep climbing higher and higher and higher. And it's only really 3 to 6 years into like after menopause, or what we call postmenopause, that those levels stay pretty stable. No matter what day you take it or time of day, it'll be roughly the same value. So FSH is helpful, but again, it's not a necessary portion of the definition, because it can be low on some days and high on other days. But once you get one high value, you know that you've transitioned into that perimenopause phase, so long as you're getting those changes in your cycle length as well. Now, you're going into late menopause transition, or that second stage of perimenopause, when you've had two or more skipped menstrual cycles and at least one intermenstrual cycle of at least 60 days or more. So what does that mean? You're tracking your menstrual cycles, and you've noticed that you skipped at least two cycles, and the time between those cycles, one of those times in that last period of time that you've been monitoring, is at least 60 days long. So for example, I have my period, and then I'm, monitoring, and I haven't had my next period for at least 60 days. So I skipped one cycle, and then I might have another cycle, and then I might skip another cycle, and that pattern continues. Now I know it's not just that the time in between my cycles has changed. Now I'm actually missing my period, and the time in between periods, at least one time, has reached 60 days or more. So that is the definition of entering into your late perimenopause stage, or your late menopause transition. And your FSH, of course, is continuing to climb if you were to do that blood test. Now, again, if you've tested FSH in that early menopause transition phase and it's been high, you don't need to test it again. Now you're just looking at the menstrual cycle. But if you haven't had a high test yet, you could test FSH again, and you would expect that it would be overall increasing compared to previous. Now, as you transition through perimenopause, through these two stages, you may experience new symptoms, worsening in the previous symptoms. So worsening in hot flashes, night sweats, problems with mood, weight gain, irritability, problems with sleep. And you may start to now experience more of those symptoms related to a declining level of estrogen, which could still occasionally be high. So, again, the test for estrogen is not helpful yet. But because overall your estrogen levels are declining through that late perimenopause stage into postmenopause, you may start to experience some new or worsening vaginal dryness, some heart palpitations, so changes in the rhythm of your heart that come and go. You might have osteopenia or osteoporosis. You may notice your brain function starts to be affected. You're just not thinking as clearly. Maybe over time, there's some dementia, Alzheimer's that develops. So this is more in the later phases of menopause, postmenopause. And then in the very, as you go along and you have a lot of decline in estrogen, that does increase your risk for heart attacks and strokes. And we're going to be talking about this in future episodes, where there are things you can do to improve your risk of developing these conditions. So it's not that you're destined to get osteoporosis, heart attacks, or strokes. It's just that that decline in estrogen puts you at greater risk for those things, and we need to mitigate those risks. We need to do things to compensate for those risks so as to reduce our risk. Now, the end of perimenopause is that last menstrual period. So you're only going to really know that you've transitioned from perimenopause into postmenopause 12 months after you've had your last menstrual period. So it's not something you can determine at the time. It's something that you determine looking back over the last 12 months. Now, people will often ask, well, what about the duration of the period? Like, my period now is longer. It used to only be 5 days, and now it's 7 days or 10 days, or it's heavier, or it's lighter than it used to be. So while those changes are expected and often experienced in perimenopause and the transition into menopause, they can't be used as definitions because they are so variable. People experience them so differently. So while you may expect to see those, we can't use them to say, oh, now you're in perimenopause, now you're in menopause. It has more to do with that menstrual cycle length and the skipping of the cycles, and then that last menstrual period with an overall trend in increasing FSH, and you will get an overall trend in decreasing estrogen and progesterone, but that estrogen level can actually go abnormally high during that transition. Now, there are other investigations that doctors will, are recommended to do based on that straw definition. So the experts who got together said that they recommend that doctors perform a baseline ultrasound investigation. So that's imaging of the ovaries and the uterus. Now, the baseline of the uterus, what they say that's helpful for is, let's say you've had that last menstrual period, and then, it's been more than 12 months and you bleed. And the question then becomes, is this just a little, last hurrah of the ovaries? Or is there some kind of issue going on in the uterus, like a fibroid or a leiomyoma or adenoma or some kind of cancerous growth? And they say that this ultrasound, having done it, in the early stages of, ideally even before perimenopause, that late reproductive phase into that early perimenopause, it gives you something to compare to so that you look back and say, oh, look at that. The thickness of your uterus has increased and it looks like you've developed, a leiomyoma or a fibroid. That's the more likely cause of this abnormal bleeding, right? That's happening now in postmenopause. So that's one interesting recommendation that I don't think is typically done. And, having read through this, I'm going to go to my family doctor and ask them to do a baseline one for me once I, start hitting that perimenopause transition phase. I think it's a reasonable thing to do. And if they're not willing to do it, I'd be willing to pay for it, just to have that baseline. And I'm going to also give you some pro tips in terms of transitioning through these phases. First, I'm just going to answer a few questions here that have come up. Shay is asking, does menopause start age as young as 40 years old? Yes, it is possible to have what's called an early menopause, and there's even a premature menopause and a premature ovarian insufficiency issue. And I've done videos on this before, explaining why this could happen, why some people get very early menopause, why some people get very severe perimenopause and menopause, and strategies that can be done to improve those, those events and prevent that from happening. So I'll be sharing some additional resources at the end. So, and Shay's also asking, is it abnormal for a period to be more than 3 days? No, some people do experience periods longer than 3 days. Sometimes it's 5 days to 7 days. Usually if it's over 7 days, that's starting to get into an abnormal range, especially if it's a very heavy period and it's starting to cause problems with, low red blood cells or anemia. And that's something that should definitely be investigated with your doctor to see if there's any issues that are contributing to that. So back to my tips. Now, the pro tip is to keep a menstrual calendar. When I looked into the research, what was often shared was that women are, often forget the details of even their last menstrual cycle. So if you want to have a better understanding as to where you are in your reproductive stage now and over time, I highly recommend keeping track of when you're getting your periods. So that will help you over time to look back and say, oh, look at that. I started to shift from that reproductive stage, that late reproductive stage, into early perimenopause, that early menopause transition stage. Another tip is consider getting a baseline FSH and estradiol test on those days 2 to 5 of your cycle and a progesterone around day 21. And your doctor may or may not, cover this with, so for example, in Canada, when your doctor orders a test and it's considered medically necessary, it's covered by public insurance. When it's not considered medically necessary, you sometimes may need to pay out of pocket to get the tests done. And these are tests that I think may be useful to do. And so that you have a baseline of what is your reproductive stage baseline, what is your normal levels of these hormones, so that as you transition through your different stages, you can then look back and compare to your normal, so that if there's a shift, for example, in increasing FSH or changing estrogen and progesterone, you can compare it to your normal versus what are called average population normals, where they take a large group of people, take the average, and compare your test to that. So again, this is not part of diagnosis or treatment. So again, you probably will have to pay for this out of pocket, but it's just one of those things that might be worth doing in a preventative way or health promotion kind of way for your own understanding of where you are in your reproductive stages of life. And as mentioned, some great additional resources that I'm going to pop into the caption. And for this, you have to go to my YouTube channel if you're not already there and look at the writing below the video. And you may need to click on the Read More tab to expand it to see all the writing. And I have many resources there. And one of them will be my perimenopause and menopause playlist, which talks about that early onset or severe menopause, talks about nutrition to support the phases and the different stages, supplements, exercise, osteoporosis prevention and management. And I also have a hormone replacement therapy playlist for those of you who are interested in learning more about that. I don't necessarily think we need to, but at the same time, many of us could benefit from that. And hormone replacement therapy can be started in perimenopause. You do not need to wait for menopause to be determined in order for you to benefit from hormone replacement therapy, particularly if you're getting those symptoms of hot flashes and night sweats and those problematic symptoms, or you're wanting to prevent problems such as osteoporosis. Those have been proven to be helpful with hormone replacement therapy, or what's also called HRT, particularly if you start it in these early stages. The benefits of HRT are much less if you wait longer into postmenopause. That we know for sure. So I hope you found this helpful. If you enjoyed this, the best way you can support this show is to subscribe. And the best way you can support your friends and loved ones is to share, because sharing is caring. I hope you enjoyed this episode. I hope you have a wonderful rest of your evening, day, or night, depending on when you catch this. And I look forward to seeing you next time. Thank you for everyone who showed up live and asked your questions. I appreciate you being here, and I appreciate your participation. Bye now.